Hello, this is a demonstration of Eligibility Self Pay, or ESP. ESP is a cloud-based utility that allows you to check appointments or encounters patients for underlying coverage that they may not know they have or for missing coverage. ESP allows you to generate an encounter or an appointment file and export those files to NextGen Clearinghouse. At NextGen Clearinghouse, your file will be reformatted into individual transactions and sent to the different payers to check for benefits. Later, all transaction results received from the payers will be recompiled into one response file, a CSV file, and imported into your database or practice management system. Before I demonstrate on how to import and export those files, let me go ahead and show you some one-time settings that will need to be set up on your initial setup of ESP. First off, we have our border states here. This allows you to check for coverage in neighboring states that may border your own. As you can see here, my practice is set up in Pennsylvania, so I'm showing the states of Delaware, Maryland, New York, New Jersey, Ohio, and West Virginia. Only thing required in this field here is that you make sure whatever state you're checking that you have a valid API that can be checking that neighboring state. So for instance, I'm going to check for, instead of including my own state of Pennsylvania, I'm going to include New York. Next, we have the default MPI. Here you would use your practice MPI that can be used in the event the encounter or appointment has no provider attached to it. In your directories, this is where you will set up your request files to be exported to, where those export files will be created. And then the response directory, this will be where those imported files from NextGen Clearinghouse will be deposited and then processed eventually. Tasking, we can set up tasks to be created off the event of a response being pulled for an encounter or an appointment. So say you get a response that comes back with copay, coinsurance, member ID, things like that. The reason you would want this import for ESP is to automatically create that task so whenever active coverage is found. Here you can define the task type as well as the work group that should be assigned the task. Whoever assigned to those tasks will attach the insurance information to the patient, and then you can eventually run an RTS transaction to get detailed copay, coinsurance information back. Last thing is notes. You can select the ESP to create encounter or appointment notes at that level that will also show that coverage, show a patient has active coverage, including what their member ID might be. So now let me show you where we export these files. So here I'm at the encounter level, and notice you can go at the encounter or appointment. You can also select which practice you would like to show. So my encounter date here, just go back to 2014, so I think I've got some demo data here. And here in this grid view, it shows the patients, which appointments, and some encounters that I have. If you're satisfied with the information that you show in here, you will click the Export button. This will take you to the directory where you want those request files to go. Here, I'm just going to enter a simple name, click Save, and my file has been exported to that directory. Now, in that directory, there will always be a background process as the automator that will always export that file to NextGen Clearinghouse automatically. It monitors that directory to see when a new file is loaded in there, and it will send that file to NextGen Clearinghouse. Now let me show you how we import those files. So say you had an export file the day prior. Today you want to check to see if that file has had responses. Here I'm going to go to Import, and it's going to take me to my Responses directory. Here I have the Encounter Responses, which is the file that I'm looking for. Here, when I click that, it will import that file into the grid view here. Again, if I'm happy with what I see here, I see some patients did come back with active coverage with Medicaid in this case. Here I can go ahead and click Process, and that data has now been processed and loaded into my database as well as into Practice Management. I will now go into Practice Management to show you where that information is going to reside and where those notes are created, as well as the tasks. So here on this encounter, this is one of the patients that had active coverage come back. Here I can go into the patient's chart here, and notice over here on the side, please note I'm using UD3 here. Over here I see 4 notes. Here is that eligibility self-pay verification, and keep in mind I am running some demo data here, but notice here patient does have active coverage. Here's their member ID and any other information that may have come back in that responses. So it does add a note to that encounter, as well as the tasking. Let me go into my work log here. And here again, we have those responses. Let's see, this is one here. And in general, you would actually see the member ID and that coverage, and this is where you could go in, pull that information by opening up the quick note, attaching the insurance to the patient, and then running RTS on the patient. And as I mentioned as well, you could do this on appointments. So let me go to my appointment book here and find a previous patient that I had submitted this on. So if I go into this patient's appointment and I go over to the Notes tab, here we see an eligibility response that we got back with ESP, again showing this patient had active coverage with Medicaid as well as Medicare. Again, we could take this information, attach the insurance to the patient, then run an RTS eligibility request on the patient to get more detailed benefit information with copays, coinsurance, things like that. Now, I'm actually going to step back into the ESP application here. And there's a couple of other things I'd like to show you. You can also do the job setup, which will have this run automatically. If I go to my service and job list, here you can create a job to have this run in the background. So say we wanted to have this run for NextGen Family Practice on the appointment export or encounter export, have this run over a predefined amount of time, at a specific time, on specific days, and have that run in the background. ESP also allows you to do some reporting. So if I go up here to Reports, go to my Encounter Reports, and here would show me a reporting feature that will show what eligibility was checked, what coverage was found. So here we see 33% with Medicaid, Medicare, third-party coverage, and any additional payers. So it's a nice little reporting feature that you can have within here. One last thing I would like to show you is a user setting. Here we can set up users to use ESP. And so if I go into myself here, you can create users or delete users, have them reset passwords for any existing users. More importantly from here, you can define access level for a user. So say I only want this user to be able to utilize ESP for specific locations within a practice, or even certain practices in general. Here you can grant or deny access to a practice or location, and it's very important, especially for those enterprises with multiple practices, to stay in compliant with HIPAA regulations. So with that will conclude this quick demonstration of ESP. If you have any additional questions, you can reach out to us at rtsenrollment@nextgen.com, or you can contact your inside sales person. Thank you.